Hi. So I know getting results from the genetic home test showing that you're predisposed to the development of type 2 diabetes is concerning, but I really don't want you to be too alarmed. This does not mean that at some point in the future you are going to develop type 2 diabetes. This simply means that based on your genetics, you're at a higher risk for developing type 2 diabetes. Genetics are just one small piece of a much larger picture. There are so many other factors that come into play when it comes to the development of type 2 diabetes, such as diet, exercise, even sleep, insulin. Insulin is the hormone that moves sugar from the blood into the cell. That way, your body can effectively use insulin. And unfortunately, some people's bodies just aren't able to effectively use insulin. Um, so even somebody who consumes a high amount of sugar, this does not mean that they're automatically going to develop type 2 diabetes. I think there's definitely a stigma around sugar intake and the development of type 2 diabetes. Again, there are so many other factors that come into play. So, in my opinion, as a friend and a healthcare professional, take this as good news. You now know that you're at a higher risk for developing type 2 diabetes. You now have the opportunity to make lifestyle changes to help lower your risk. Um, you don't have to make any drastic lifestyle changes. Watch your sugar intake. Make sure you're eating a balanced diet, especially a diet that's not carb heavy because carbs do turn into sugar. Make sure that you're not living a sedentary lifestyle. Even a short walk daily can really go a long way. It's just really important that you try to move your body daily. Make sure you're getting enough sleep. When you're not well rested, that puts a lot of extra stress on your body. Um, Also, make sure that you're, going to regular checkups with your provider. Because you are at a higher risk, you will want to get labs drawn regularly just to make sure that your blood sugar levels remain within normal limits. But again, try not to be too concerned. You now have the knowledge that you are at a high risk for developing diabetes. And now that you know that, you have the opportunity to do something about it and to make lifestyle changes to help lower your risk of developing type 2 diabetes in the future.